This is Chapter 4, Body Structure. The levels of organization as described in your textbook are as listed 1 through 5. The body starts at a cellular level. Cells come together to form tissues, tissues form organs, organs form systems, and then systems make up the organismic level or the body as a living entity. So if I gave the example of starting at the cellular level of a kidney, the basic unit of a kidney is a nephron. So one nephron would be a cell of a kidney. If we bring more than one cell together, we have a kidney tissue. So if I have nephrons that form tissue, then the tissue forms the kidney as an organ. So we have the organ at that point. Then the organs form the system level. So this would be the genitourinary system, which would include the kidneys, the ureters, the bladder, the urethra. Then the systems come together and form the body at an organismic level. So the systems like the cardiovascular system, the reproductive system, the respiratory system, the genitourinary system, all of those come together to form the body as a whole, which is a living entity which can exist independently. So the thing that you need to remember is that we start at a cellular level and move towards greater tissues, so to a greater living entity. So cells form tissues, tissues form organs, organs form systems, and systems make up the human body. The anatomical position is discussed in your textbook, and its placement of the body in an erect stance with the eyes looking forward, the upper limbs hands to the sides, the palms facing to the front, and the lower limbs parallel with the toes pointing forward. Unfortunately, this skeleton is not in the anatomical position because the palms are not facing forward, and the arms aren't really towards the sides. They're kind of off lateral from the body. Planes of the body are discussed in your textbook on page 44, and there are different planes that are described. The mid-sagittal or median plane divides the body into right and left halves. The coronal or frontal divides the body into a anterior and posterior, or front and back. And also we can describe that as ventral being the front side and dorsal being the back side. The transverse or horizontal plane is the upper portion, dividing the body into the upper portion and a lower portion. So the upper portion is now referred to as the superior aspect, and the lower portion, the inferior aspect. There's a little typo there. Body cavities, if you look on page 45, there's two major body cavities that are listed. The dorsal cavity, which is also known as is located on the posterior side of the body, includes the cranium and the spine. And the ventral cavity is belly side, so that's going to include the thoracic cavity, the lungs, the abdominal region, the abdominal pelvic region, digestive, excretory, reproductive systems, and its structures. So two major body cavities, dorsal, which is on the back side, and ventral, which is belly side. There's 4 quadrants listed on your textbook on page 46, and the way that that's arrived at is if you took a marker and you drew on your abdomen, and you made a cross with the section intersecting at the belly button. Then the quadrants are labeled right upper, right lower, left upper, and left lower quadrant, and given the respective abbreviations, which you will need to know. There's also a way that the abdomen can be divided into sections, and that's known as the 9 regions of the body. If you look on page 46, this is arrived at as if you would take a marker and draw on the abdomen and make a tic-tac-toe board across the abdomen, with the center square being around the belly button. And so you can look at those in the textbook, and each of those sections or regions are then given a corresponding term or name. These are used when there is charting in words to describe to another healthcare provider where something is located. For the quadrants, an example may be the patient has pain in the right upper quadrant, and so that would give another healthcare provider an idea of where the pain would be located on someone's abdomen. The spine then is divided into specific regions, and the cervical region is the neck region right through here. We have 7 cervical vertebrae, and they are listed as C1 through C7. The thoracic or chest region is just below the cervical, and so that is about right here, thoracic and T1, and then that also goes down to T12, which is the last thoracic vertebra. So T1 through T12, there's 12 thoracic vertebrae. The lumbar then is the first part of the lower back, and that is the lumbar region. There are 5 lumbar vertebrae, and they're labeled L1 through L5 accordingly. The sacrum, or the sacral vertebra, is right below the lumbar vertebra. It's the second part of the lower back, and there are 5 of those as well, labeled S1 through S5. And then the coccyx is this little guy peeking out here at the bottom, which is also known as the tailbone, which is comprised of 4 fused bones, so there are no letters or numbers assigned to it. Directional terms in your textbook on page 46 and 47 are used to indicate position of a structure in relation to another structure. Anterior and posterior are used when describing anterior, the front of the body, and posterior, the back of the body. Medial is pertaining to the midline of the body or a structure, so it's not necessarily the middle of the body, but it could be the medial portion of the patient's thigh. That would be the middle of the thigh. Lateral is a term that's used to describe pertaining to a side, and this doesn't necessarily mean your side like where your ribs are, but it could be the lateral portion of your face, which would be your cheek region. Proximal and distal are also used in medical terms to describe direction. Something that's proximal is nearer to the center, the trunk of the body, or the point of attachment. Something that's distal is further from the center, the trunk of the body, or the point of attachment. And we'll talk about that a little bit later. Pathology, then, is when homeostasis is significantly interrupted. Now, what is homeostasis? Homeostasis is a state of equilibrium in which there's adequate water, acidity, and temperature. If that internal environment is upset in one of those 3 fashions, then we have a pathological condition. A disease is a study of a condition that presents a group of signs, symptoms, and clinical findings. An objective sign is observable and can be measured by others. For example, we can use a sphygmomanometer to measure someone's blood pressure. It gives us a reading, such as 120/80. We can use a scale and we can weigh someone. It gives us a reading in pounds or kilograms. We can also use a stethoscope and listen to a patient's heart and count how many beats per minute the heart is beating. So those are all observable and can be measured by others. A subjective symptom then is opposite of objective. It is experienced only by the patient and it's very hard to measure. The most common subjective symptom is pain. Pain is only experienced by the patient, and it's extremely hard to measure. We can ask a patient on a scale of 1 to 10, how bad is their pain, with 10 being the worst pain ever, but we also know that someone's 10 could also be someone else's 2. So it is subjective in that it depends on the patient's pain tolerance. Dizziness and nausea are also subjective symptoms. We don't necessarily have anything that we can hook the patient up to or measure. Those are symptoms that are only experienced by the patient. They can only report them to us. We can't objectively observe them. Etiology is the study of all factors involved in the development of diseases. It's like putting puzzle pieces together. When you put a puzzle together, you put all the corner pieces together and you kind of put out the frame. And so when we try to collect evidence for the physician or physician assistant to arrive at a diagnosis for a patient, we gather the information for them so that they can put the puzzle together. So if we interview the patient and they tell us that they have frequent urination and thirst, we look at their lab work and they have an elevated blood sugar, then we can put those puzzle pieces together and say, gee, what caused this? Potentially they have diabetes. The pancreas is not producing enough insulin, and that's making the blood sugar be at an abnormally high level. Now, we don't do that as healthcare professionals. We gather the evidence for the doctor or the physician assistant or nurse practitioner, but we never diagnose. So the diagnosis then is establishing a cause and a nature of the disease. When we figure out what is it that's actually wrong with this patient. Do they have diabetes in the example that I shared? Prognosis is the prediction of the course of disease and a probable outcome. And when we talk about prognosis, we usually think about a patient that has cancer. A patient that has cancer usually wants to know one thing, and that is, how long do I have to live? Well, the prognosis for that patient, depending on what type of cancer they have, is then given to the patient. So let's say that it's lung cancer. Lung cancer has a very poor survival rate. Most patients die within the first 2 years from their diagnosis. So that would be their prognosis. But it doesn't necessarily have to be about cancer. It could be something as simple as strep throat. You are diagnosed with strep throat and you say, well, what's my prognosis? And the doctor says, well, we'll give you antibiotics, and in 2 to 3 days you'll start to feel better. You finish the antibiotics and you will be better in a week. Now, it's a probable prediction. It's not a guarantee that that's going to happen, but it's just a prediction of what usually happens during the course of a disease. Idiopathic, then, is a disease in which the cause is unknown. The way I remember that is, if it's idiopathic, your doctor's an idiot. He does not know what caused it, which is a little bit of a funny. So, what I'd like for you to do now is to exercise what you know with regards to what we just talked about in terms of the directional terms. So if you touch the lateral portion of your head, you're going to be touching the cheek portion of your head. If you touch the medial portion of your chest, you would be right between the breasts on the breastbone or the xiphoid. If you move your hand proximal to your body, you would move it closest to the point of attachment. So you would move your hand towards the midline. If you moved your hand distal to your body, you would take your hand and move it away from your body. And if you moved your hand anterior to your face, you would be putting your hand right in front of your face. If you put your hand posterior to your neck, you would be putting your hand at the back of your neck, at the cervical region. Now, in each chapter, there are lists of terms that are in the diagnostic, symptomatic, and related terms. You will need to know the ones that I have specified in the PowerPoint presentations. Any of the other terms you're not required to know unless you can take the word and break it down into word parts to determine its meaning. So for this chapter, you need to know adhesion, dehiscence, febrile, homeostasis, inflammation, and sepsis. You can find those terms on between pages 53 and 55. Other important diagnostic and therapeutic procedures that you need to know for testing. Pages 55 through 59. You need to know what an endoscopy is, laparoscopy, thoracoscopy, urinalysis, computed tomography, magnetic resonance imaging, radiography, ultrasonography, biopsy, and cauterize. From this chapter forward, you will also be given spelling words at the end of each PowerPoint presentation. Spelling words are taken from the word examples used in the word analysis on pages 47 through 52. This is the list that you will be tested over. Cytologist, posterior, proximal, pelvimeter, erythrocyte, gastropathy, sonography, cirrhosis, chloropia, and morphology. At the end of each chapter, from chapter 4 on through the end of the textbook, you will also see that there are abbreviations listed. I will give you the abbreviations that you are required to know. If they are not listed in the PowerPoint presentation, you are not required to know them for testing. So the important abbreviations for this chapter are DX for diagnosis, LLQ left lower quadrant, LUQ left upper quadrant, RLQ right lower quadrant, RUQ right upper quadrant. SX means symptom, TX treatment, and US ultrasound. You are responsible for memorizing all the medical word elements and their meanings starting on page 47 through 52. The first one that you need to know on page 47 is cyto. Cyto is a combining form that you will learn means cell. So this is where you're going to make more flashcards. You do not need to know the word analysis, just memorize the element and its meaning. Many of the questions will come directly from the flashcards or the word parts that you are to memorize for this chapter, chapter 4. This is the end of the presentation.